Good morning, everyone. It's interesting as I sit there and listen to the presentation on advertising. Once again, as a parent and as a professional, I was outraged that I wonder why there isn't more outrage, and I want to show you how I use my rage because all of these things we talk about, Joe, I'm not satisfied with just being the heart. We're going to change the way children eat. We're going to ensure that children of color have the same life qualities that every child has. And we should want for every child what we want for our own child. And let me say that again. We should want for every child what we want for our own. Think about that. So I want to tell you a quick little story. I am the Director of Nutrition Services with the Riverside Unified School District. Riverside is the 15th largest school district in California with 43,000 students in 47 schools. We provide 34,000 meals a day, and 68% of the children in our district come from at-risk families. Let me tell you a little bit about at-risk families. I'm a product of an at-risk family. I know hunger far more intimately than I care to discuss. And when we get real serious about education, we'll get serious about ensuring that every child is fed in the morning, prepared and ready to go to school. You can't focus, you can't learn when you're hungry. So I go into the I go into the Riverside Unified School District in 2002. The Nutrition Service Department has a $3.1 million deficit they owe to the general fund. They built a central kitchen, $28 million, and couldn't make the payments, the $500,000 lease payments. And they asked me what was I going to do. And I told them I was going to put salad bars in the school. And that's what they did. They laughed. I stand before you 10 years later, and we've eradicated the $3.1 million debt. We have a $5.8 million reserve. We paid off the $28 million building, and we have a program, a nutrition program, that we can be proud of, one that our employees answered the call, and it was simply, what wouldn't you do for your child? What wouldn't you do for your child? We've heard the remarkable stories of mothers lifting cars off of children and what have you. I have two sons, and if you told me I had to leave here today for them to be okay, I'm ready to go. So know that this was the type of effort we asked of our employees, and I have 328 of them, and it's their children. And that's what I reminded them. I'm not asking you to do something for some stranger. These are our children, and we can change their faith. We've all heard the negative statistics about how long a kid will live and how many will be exposed to diabetes, and we know that as children of color, that the statistics are even worse. So it wasn't very hard to motivate people behind this cause that I had. And I did what I usually do is, I pushed the wrong button here. So, okay, here we go. So the salad bar that I talk about is a farmer's market salad bar. It's dubbed that because we buy produce from the local farmer's market. We buy it fresh at the peak of its season, and we serve that to the children. And the salad bar is unique from what most people will tell you in that it was a self-contained meal. Our children chose between the traditional hot lunch or the all-you-can-eat self-serve salad bar. And people said, well, they won't eat vegetables and they won't eat the fruits. And we proved that that was not the case. The salad bar program decreased accessibility. Many children didn't have access to fresh fruits and vegetables. I guarantee you that 68% of kids don't have a fruit bowl sitting on their dining room table like many of us might. They in many cases didn't know what jicama was or kiwi was, didn't have that opportunity. So my fight for diabetes and the fight of those who've been on the front lines with me in Riverside is simple. The experts told us that kids needed to consume more fresh fruits and vegetables, and we found a way to make that happen, to provide the access, to modify eating behaviors. They said that you couldn't modify eating behaviors, and we proved them wrong, because children will eat healthy when given the opportunity. The important thing about the presentation that you see before you is notice that it's pleasing to the eye. The salad bar appeals to all 5 of the senses, and that's important because we're taught in the restaurant industry that people buy with their eyes. The other thing is it has to be user-friendly. You might say, well, we've always had apples and oranges in schools. We've had fresh fruit and it ends up in the trash. Well, Mom, you remember the 3rd grader? 3rd grader's losing his teeth, but we give him a whole apple and we wonder why he doesn't eat it. Or you give a kindergartner a whole orange. I'm 58 and I can't peel an orange. And we wonder why they don't eat it. So notice that it's not only pleasing to the eye, but it's user-friendly. And again, in most cases, the fruits and vegetables that we receive were picked within 48 hours of the time that it's delivered to us. So I don't need to tell you, if you've been to the local farmer's market, the difference in the fruit and vegetables there than what you find in the supermarket year-round. They thought, well, we know what kids do, you know, they pick in their ears and their nose, they're gonna make people sick, and I just remind everyone that we've been having kids serve themselves in the salad bar, 6 million salad bar meals, and I haven't lost a child yet. And the skeptic will say to me, but that doesn't mean you won't. I want to tell you that once we got the salad bars now in Riverside, it's in all 31 of our elementary schools. The kids, it's no longer an alternative to the traditional lunch. It is the lunch. We went to last year what we call Salad Bar First. And Salad Bar First is patterned after Dr. Weinzink's theory of behavioral science, behavioral economics at Cornell University. And his belief is that based on where you placement of food will have impact on eating behaviors. So what we wanted to do was give the children the best of both worlds. Under the salad bar, we were feeding 33% of the children at its peak, and that's great, except for we wanted access for 100%. So rather than making them choose between the pizza and the salad bar, we put salad bar first so that now every child goes through the salad bar, they make their choices. It's a lot like a buffet. Think of the buffet when you go through all the salads and inexpensive stuff is there. And then when you get down towards the end where that prime rib is, you have no room on your plate for it. That's pretty much what we were thinking of with the salad bar. We wanted to change the center of the plate, the focus away from the hamburger, the hot dog, get kids to eat the colors, to engage children. We teach them to eat the colors, and as they go through the line, at the end they get a sticker that says, I have a rainbow in my tummy. Now that may not be too impressive to you guys, but to a 3rd grader, I'm really cool. And so Salad Bar First is working out very well for us. We're finding that parents are asking, how is it that you have my child to eat these vegetables? Or they talk about how when they go shopping now, the kids are putting things in the basket like kiwi and jicama and what have you. And you know, we can teach each other a little bit about food. Food is that unifier worldwide where I guarantee you an African-American kid in the inner city won't know what jicama is, but the little Latino kid will tell him that if you put a little chili and lime on it, he got it going on there. And so we can learn a little bit about how to eat and that it's fun. Salad Bar First gives kids a chance to enjoy fresh produce. and it's offered each day. The students go through the line, they make their own choices. These are reimbursable meals. And notice that with Salad Bar First, there's a lot of uproar recently over the Healthy Hunger Free Kids Act. Some said it was too expensive, and some said it was too soon. And the fact of the matter is that with the dire statistics that we have today, if it was your child and you knew that the doctor told you you could do something about it, when would you act? You'd act now. And so for those that tell you it's too expensive, don't believe it. At the time that we owed $3.1 million, we were investing $180,000 a year in salad bars. We recognized that only 40% of the kids that attended school were eating with us. That number is now 70%. And so what I offer you is that for those who say school districts or the food service fund, which is a separate fund from the school district, which is one of the only funds in the school district that is self-sufficient, meaning that if we do our job right, we'll be fine. There's no one that says, here's $20,000 and you've got to act within that. My budget in Riverside in 2002 was $8 million. Today it's $19 million. What was the difference? We treated it like it was a business. We're in the nutrition business. We grew our business. We took an employee cafeteria, turned it into a restaurant that now feeds the public on the outside. We hired a chef who prepared those meals. We did something very unique in that for years we have offered teachers kid food and then wanted to charge them adult prices. Now, I don't know about you, but I don't eat chicken nuggets. I'm going to tell you that right now. Don't eat them. And neither do our children in Riverside, because we took them off the menu without ever having the discussion. And the reason we were able to do it is because of the work of our chef. And here's an example of what we do in the secondary schools, and in a second I'll have pictures of it. There's Chef Ryan out at the schools, and we've got our banners, marketing materials. We're doing surveys. We're having kids have taste tests of his line of sandwiches and salads, and based on their responses, that's what gets served in the schools. So it's important, like in any business, that you go to your customers and you survey and you experiment with whatever it is that you think will sell. So when you ask, well, how did you go from 47% to 70%, is we went to our customers, we found out what they wanted in a healthy context, and know that we did not have a conversation around healthy. Kids don't want to hear that. We just gave them options between healthy and healthy. We took out chips and fries and all of the other stuff. And when they asked why, we told them that we had a responsibility to ensure that they lived long and healthy lives, and that part of our role in the education environment is to teach our kids to develop lifelong healthy eating habits. Here you see pictures of Chef Ryan's turkey, Caesar ciabatta, and an example of how we do this is we take the government commodity, the fajita chicken, which costs us about 1 cent a serving, and as opposed to about 38 cents if we were using market price chicken. By doing that, we're able to offer a non-traditional bread like the ciabatta, and Chef would want you to know that he put ciabatta in the school before Jack in the Box put it on his menu. So we continue to expand Fresh Express. We're also seeing that the rotisserie chicken is another one where I want you to see how were we able to change school food service. We took the government commodity 8-piece chicken. The chef developed different rubs, what we refer to as 5 platforms: rotisserie chicken, barbecue, lemon herb, grilled ranch, and sesame. taught the staff how to use those rubs, how to cook the chicken. That's the chicken that's being served. Kids are getting less processed, fresh food, and the genius in it all is we reduced our price again, which allows us then to spend money in other areas on things that are more expensive. Quickly, I'm going to go through our summer feeding program. We have a simple motto that hunger doesn't take a vacation, and neither do we. We barbecue at 24 parks for our children, and we grew from 32,000 meals in 2008 to well over 300,000, and we expect to hit 500,000 this summer. And this is a look at it where we're getting families to go to the park, take back over their park, get active and eat. And there's 5 choices of foods that they could eat. And then I'm going to end with the breakfast in the classroom. I think it's important that all children have access to breakfast, and that's not just those at-risk families. There are those like my son took a bus, he'd be on the bus an hour, and the bus would get to school late, so he never could eat breakfast. And so if we had breakfast in the classroom for all of our children, contrary to those that tell you it takes too much time away from instruction, we're finding that's not happening, that breakfast in the classroom is really changing things, behavior. We're finding less visits to the nurse, less visits to the office, well-behaved children. And again, participation goes up, brings in more revenue. We're able to change the dynamics of school food service. We refuse to let you beat up on what we do. We intend to be the catalyst for change in America. Thank you.